I'm so confused.
Hello, everyone. This is Lindsay Bourne. Hi, I'm the Director of Education at PFCC Partners, and thank you all for joining us on time. We will be getting started in just about 2 minutes, so hang tight, and we will be getting started soon. So thank you.
Am I doing this right?
Is that Dasha?
This is Dasha, yes.
Hi, you are on and good to go, so no worries. Can you see
Okay.
my screen?
I got you. Yeah.
Okay, you're good.
Okay.
We'll get started in just a minute.
Okay.
Okay, so we are right at the top of the hour, and we are very excited for our presenters today, so we're going to go ahead and get started. Welcome, everyone, to the PFCC Partners March Workshop. I will be introducing our presenters in just a moment. We are very excited to welcome Donna Provenzano and Pat O'Hanlon, from Children's Specialized to talk with us today. So I will introduce them in just a moment, but I wanted to do a quick housekeeping before we get started on using Zoom. We are Zoom in, so you should see my screen. The presentation will be shared here. If you're new to Zoom, if you hover over your screen, you should see a toolbar where you can mute yourself while the presentation is happening. And you can share your video, like some of us are as well, by clicking the start or stop video function. As I said, as the presentation is happening, please mute yourself, and we will have some time for questions and discussions throughout, and we will leave some time at the end for some questions as well. You will also find a chat box there. It might be just right on the toolbar screen, or you might have to go to the More option and find the chat. In there, you can ask questions. I will be monitoring the chat box for Donna and Pat throughout their presentation. So you can put your questions there, and then we'll stop and answer any questions that you might have. Also, if you are having questions about using Zoom throughout, please feel free to put those in Zoom or send me a private message. I will help you work through them. But it looks like everyone is on and good to go, so we will go ahead and get started. So with that, I am very excited to welcome Pat O'Hanlon, who is the Family Faculty Manager, and Donna Provenzano, who is the Director of Family-Centered Care from Children's Specialized in New Brunswick, New Jersey. Welcome, Donna and Pat.
Thank you so much for having us today. We're excited to be here.
Thank you.
Welcome. Thank you. And the floor is yours. Just tell me when to advance your slides.
Okay, thank you. Just wanted to share with you a little bit about our hospital. The picture that you see there, the white building, was our children's home back in the 1940s, and we started out with a home for children who were affected with polio. And as things have transitioned, the building that's next to that is our state-of-the-art inpatient rehabilitation hospital. We provide world-class specialized pediatric services so that every child can reach their full potential. The unique difference at our children's hospital is that we partner with families in a true collaborative way to make all of the services, programs, and systems that we put in place to make them more personalized, to meet their needs, and effective for both our families and our staff. Please advance. Just to give you a little background on our hospital, we treat a wide range of special healthcare challenges, from chronic illnesses to complex physical disabilities like brain injury, spinal cord injury, to developmental and behavioral issues like autism and mental health. The population we serve is birth through 21, and in 2017 we served over 34,000 children. We have 13 outpatient sites throughout the state, 2 long-term care facilities where our patients live there and there are residents, and then an inpatient rehab hospital of 68 beds. You can advance, Lindsay. Thank you. I just wanted to share with you the core principles of patient and family-centered care. With us, when we look at respect and dignity, we want to make sure that every interaction is anchored in a respectful partnership. We want to anticipate and respond to our patients and family needs, and that means that all of our healthcare providers, as well as our non-clinical staff that work with our families, that they're going to listen to and honor our patients and families' perspective. From an information sharing standpoint, we want to make sure that we share complete and unbiased information with our patients and families. We want them to be participatory in their care, right? We encourage them and we support them in participating in care decisions at whatever level they're at. We want to meet them at the level that they're at. We don't want to dictate that. And I think the biggest piece in terms of when you look at these principles of family-centered care is around the collaboration. I think it's very easy to take the concept of patient and family-centered care and to quickly anchor that to care. Well, we're patient and family-centered, right? We hear a lot of organizations say that, but we took an approach to really look at all levels throughout our health system. So we wanted to collaborate at all levels of healthcare, not just on the clinical side of the house. And we're going to give you examples of how we've done that and how we've been able to integrate patient and family-centered care. Please advance. Thank you. We're very fortunate at Children's Specialized Hospital. We have an organizational commitment to patient and family-centered care. Our leadership team and then staff at all levels, plus our family faculty. We actually have families that are on staff, and our Family Advisory Council. We all are partnering together to improve care, services, process, and systems. And we're really looking at every opportunity. How can we involve families in all aspects of our organization? Please advance. Our commitment to practicing patient and family-centered care, it shaped and influenced the culture that we have. This slide here represents for us, these are the pillars at our hospital. All of our corporate goals align to these pillars, and then every year under these 5 corporate areas, we have strategic initiatives, and all of those strategic initiatives flow up under one of these areas. We're very proud to say that our patients and families, that's how we view our strategic plan. It's viewed through their lens. That's how we look at every day when we're doing our work. And we want to let you know on the next 2 slides, you're going to see what these pillars mean to our patients and families. Our families actually gave us the definitions in their own eyes of what they mean. If you could advance. For our growth and population health, the key for our families, they wanted to make sure that we were aware that it was that awareness to make sure that we're providing them with access to state-of-the-art medical care. For quality, they want to be respected as a person, and they want us to work together with the team so they could reach their full potential. For finance, they want us to partner with them to help them have options for how they're going to pay their bills, but their main focus is they want us to allow them to focus on their goals. Please advance. Under academics, they want us as an organization to be committed to delivering them cutting-edge, state-of-the-art patient and family-centered care. You know, they know that we have a lot of research going on at our hospital and throughout our larger health system that we're a part of, or part of the RWJ Barnabas Health System. They want to make sure that we continue that education, that the staff receive that training. And then from a consumer point of view, they want to make sure that we're valuing and partnering with them to provide them superior service. And I think that what has set us apart is we've been able to find a way. I mean, families have written these definitions, and it just reminds us every day when we go about doing our work, but we actually have families who are part of our staff. They serve on all of these pillars, so we have the family voice at the table when we're collaborating together. Advance, please. I want to share with you our journey started back in 2004, so we've been on this journey for a little over 14 years. You know, when we first started, it was just a small group of us. I was not the director of patient and family centered care. I oversaw 2 clinical areas for the hospital. I was a therapist, is how, you know, when I started here at Children's. But we were solely this small group just focused on, well, how can we look at involving families in different ways in our hospital? And where we are today, like, we haven't learned it all. I mean, we're by no means, you know, experts in everything. What we've learned every day is that the more that you partner with families, bring them into your organization, truly commit to having them at the table, that you're going to have success that you just couldn't even have imagined. And I just want to share with you, when we had set out to do our patient and family centered care, we set out to do 5 priority areas. We presented to our board of directors, and I think I had been at the hospital at that time about 20 years, and, you know, I was sharing with them, you know, we want to institute, you know, additional things that are going to help us move patient and family centered care forward at our organization. And I could see the board of directors kind of kicking our president under the table, and I knew he wanted to ask a question. And he said to me, you know, Donna, you can't tell me that we're not patient and family centered. And I paused for a minute and I said, you know, no, like, we are patient and family centered, but we want to bring it to a different level. And that level was truly involving everyone. And I can give you an example. Our chief financial officer at the time, as we were implementing the beginnings of this work, you know, he said to me, Donna, this is great what you're doing with patient and family centered care, but it's never going to touch me. And I can tell you that, you know, now 14 years later, I mean, I can share, we have an amazing relationship with finance. Our chief operating officer, our financial officer, they help co-write our most popular family resource with us, which is an insurance pocket pal. So I'm just trying to give you some real life examples of, you know, you might just need to start small, but if you can be persistent at this, it's truly going to make lasting changes for your organization. If you can advance. And I get this question a lot, you know, when I talk about the families that we have on staff and the 25 families that we have on our Family Advisory Council. You know, everybody wants to know what their qualifications are. Their qualifications are that they're families. When I'm interviewing them with another family, I'm not asking for some key characteristics in that person, just like you would do if you were interviewing for a staff position. So it's just really critical that, you know, their expertise is that they're a family and that they either have had a child that has received services at our hospital or is currently receiving services. So that's their expertise, and we never want to lose that. Next slide, please. Of our team, and it has since grown. We just hired additional 4 family faculty. We're up to a total of 14 families that we actually have on staff that work per diem for us, and Pat works full-time as family faculty manager. Next slide.
Great. I'm going to go to the next slide, and I just want to remind everyone to, as you're logging on, also to please mute your lines through the presentation. Thank you. Sorry about that.
Oh, no, no worries. And then these next 2 slides are just giving you some concrete examples, because I think it's easy to say, okay, Patient and family-centered care, let me equate it to some of those things that more related to care, but we're going to show you just some different examples of how we've integrated it, like throughout many aspects of the hospital. So when I've talked in reference before about our family faculty, we actually have hired families on staff, and they are currently at all of our locations, our outpatient sites, our inpatient sites, our long-term care sites. We formed a family advisory council. It's been 12 years going. I'm going to not spend too much time on that because Pat is going to be going into that in more detail. The other area that we really focused on early on, and it has since grown, is to have family representation on all committees. And I'm just very proud to say we actually have families serving on our board, our quality board. We have them on performance improvement, patient safety, environment of care, Press Ganey, clinical operations, and then I had mentioned all of our pillar teams. You know, today there isn't a committee or a task force that meets in our hospital without having the families at the table. But I can tell you, like it was when we first started out, I can remember when we first had our family on our clinical operations meeting, you know, I got a call from our chief medical officer, you know, after that meeting, he wanted to talk to me, and I'm like, you know, that's fine, like, how did everything go? And he was very surprised that our family was vocal. I think in his mind, this is going back 14 years ago, I think in his mind, he was thinking, okay, I'll have a family on my committee, but maybe they're going to sit and be silent and just listen. But, you know, as long as they're respectful, right, and have all those characteristics that, you know, you all want your families to possess, you know, as you're involving them in your family, you know, you can just do great partnerships. In our organization, any communications that's being sent out to family, from our welcome letters to therapy, from our insurance letter reminding our families about their co-pays, they do not go out to our families at large, over 30,000 of our families, without our family advisory council or our family faculty looking at it, making sure that the language makes sense. If it's not going to make sense to them, we're going to get questions when it goes out to our larger consumers. And then in terms of families giving input into policies and procedures, you might think, well, why would they give input into policies? Because policies are written for the hospital, right, or for the organization. Well, you know, we have families on our operations meeting looking at every policy that the organization has. Where are they giving input? Well, they want to make sure that is that language written in that policy, the staff is going to look at that. Is it from a patient and family-centered place? Is it friendly? Does it make sense? Are we, that language, that culture, that feeling, it has to embed everything that you do. And then just to give you an idea in terms of procedures, our families review everything. We've had families on, we have a phone tree for our hospital. Our families have revised that phone tree with our telecommunications. It's on its third revision, just to give you some concrete examples. For human resources, we have families in terms of onboarding. We're not only hiring for best clinically for the skill set, but we're also hiring for individuals who want to believe in our mission and vision, want to live our standards of excellence, and practice patient and family-centered care. So we have a behavioral component, a behavioral interview component that really goes into those patient and family-centered care aspects. And then I'm very proud to say that we have families co-teaching our hospital orientation for all of our new hires, as well as our service excellence training. Please advance. And then just some other ways that we've integrated patient and family-centered care. We just got through our process of doing our annual performance reviews. Well, patient and family-centered care is a core competency. As part of that review, it's on our department orientation checklist for any new hire. Our families, equally that we have on staff and our council, they equally support our staff as much as they do our families. So we don't view them as patient advocates. I can tell you, our families can't even walk into our buildings now without a staff, you know, please, can I talk to you? I have a referral. I'm having, you know, this type of situation with a family. Can you help me with that? Can you look at this for me? So it's truly a support as much as it is for our families as it is for our staff. Our Family Advisory Council and our families on staff, they've educated and they continue to do education to our staff. They've done in-services on various topics as well as provided workshops for our families. So education is a big part of their role. They've developed and provided resources. I won't go into that in detail because Pat's going to share some of the amazing resources that they've created. On our inpatient unit, our families on staff, they actually attend and participate in family meetings. They're there to support a family when they might be receiving that diagnosis or the prognosis of their child, as well as to support the staff in those meetings. And then we're very fortunate every year. We have great working relationships for family advocacy. We go down to Washington, D.C. We're meeting with our congressmen and our senators to advocate not only for our hospital, but for children's health care. And we bring families and our children down every year so that, you know, they can have a voice and they could leave their message with our Congress. And then I think a key is that, you know, none of this would work. A lot of people say, well, you know, this could just be the fluff, right? But, you know, where are you actually achieving goals? Our Family Center Care program has goals every year. Those goals link directly to our organizational goals as well as our Family Advisory Council. So it's very meaningful work. Advance, please. I don't know, Lindsay, Pat's going to go into our Family Advisory Council. Do you want, I don't know if you wanted to take any questions now or if you want us to continue. We're open to either way.
We can stop there. There aren't any questions in the chat box right now, but if anyone wants to ask a question so far of Donna's portion of the presentation, we can open the line for a minute.
Hi, Donna. This is Libby. Thank you so much for joining us and sharing your amazing work. I'm curious how, as you've included advisors in interviews and in those activities, what was the response from the folks you were interviewing? Was
Oh, no, I mean, initially...
that surprising? Did they recognize who was in the room?
Oh, I'm sorry. I don't know if somebody cut out. You know, initially a little surprised, but I think that it really set the tone once the family, you know, met with them and talked with them. I think it sets the tone for them to know that, you know, our hospital just doesn't check off a box to say that we're patient and family centered care. You know, we want even our staff who is coming in on interviews, we want them to know that this truly is part of our culture and to get a feel for them and to be able to support those efforts throughout the hospital.
Terrific.
Pat, do you want to?
Well, I mean, I could just share an experience I had early on when I first started as family faculty. The first committee that I participated on as a family was our operations, and it was my first meeting. And prior to the meeting, our CEO, but at the time he was Chief Operating Officer, he actually chaired the committee, and he met with me first, and he just, you know, wanted to calm me down and say, you know, you're going to join in, you're going to give your family perspective. He asked me some questions. I was just so nervous meeting him. I don't even really remember the interview, but he interviewed me first and wanted me to be relaxed to join the meeting. And when I went to the meeting, people wouldn't talk to me. These were managers and directors in our hospital. Like, they wanted to know what I was doing there and kind of whispering among themselves. It was so nerve-wracking. But as the meeting progressed, you know, Warren is his name, you know, he had interviewed me. He knew a little bit about me, and he figured out a way to include me in the conversation, knowing I could easily answer what he was, you know, sharing my way. So I felt relaxed, you know, to do that. And once the other group saw that our COO was including me, they knew that families were going to be here to stay and that our senior leaders were supporting that. And it was, you know, a moment in time that transitioned me from not being welcome to, okay, we got to figure out how we're going to work with the family, to a point today where I'm just part of the team. I get assignments, I have follow-up, and I'm respected because I'm a family voice, not for any other reason. So it's really amazing to see where we've come from. But I remember that first meeting. It wasn't easy.
I bet. Well, thank you for sharing that. I think you're really highlighting how we shift the culture. Fantastic. Thanks.
Okay.
You good? Okay, good. So Lindsay, thank you, and Donna, thank you so much for the opportunity to, share, what our Family Advisory Council is doing. And, I'm really hopeful that you guys will share with us too, because we just absolutely can learn so much from each other. So going back to our council, it was actually an organizational goal in 2005. So this was a serious goal for our hospital, from that high level that we were going to have a council formed. We had a timeline to completion, and from it being a goal in 2005, we began in November of that year. We identified, first of all, task force members. Donna was on that task force. I wasn't on there, but it was kind of a multidisciplinary group from the hospital, and there was one family volunteer on that group at the time. Her name was Carrie, and they, met. They researched what other facilities were doing. I believe they actually went out and attended some conferences to see what was going on with regard to patient and family-centered care. And I think for me as a member, and I'm really passionate about our team, when I hear the stories, every single member from psychology, nursing, there was someone from like our environmental dietary area, but they were all true believers in patient and family-centered care. When you get your true believers together, amazing things can happen, and they were working in partnership with the family to do this. So after they researched other facilities, they decided to come up with to begin to look at what the mission and vision could be for our council. And they did this in partnership with families. They came up with the structure. So how was our council going to run? Were we going to have different councils for different service areas? Or were we going to have one council for the entire hospital? And for us, it made sense to have one council with representatives from all the different service areas, from inpatient, outpatient, and long-term care. And it was really important to us that our council be family-driven. So we have a minimum of a 3-to-1 ratio. Our proposal at the time was to have 15 families minimum and 5 staff, so that it was always a family-driven council. With regard to our membership, both our staff and our families, we ask for at least a 1-year commitment because it's a doer group and we have annual goals. So you don't want to be in the middle of a goal and have people dropping off. Of course, things are going to happen and we plan for that, and we're always recruiting, and that's an ongoing thing. But when we're interviewing, this is an important thing that we discuss with everyone we interview, that commitment.
Lindsay, can you advance the slides, please? And then can you go one more?
I'm sorry.
No,
Lindsay.
it's no worries. I got you. Yep.
Okay, so a little bit more about how we formed our Family Advisory Council and kind of the structure involved with it. We did decide to give our families a $25 stipend payment for each meeting they attend. There's a minimum of 2 meetings per month, a large council meeting, and then the way we do our work with regard to our goals, and we'll explain a little more about that in a minute, is we break down into work groups. So it's kind of a minimum of $50 per month per family. It's not that much, but it really gives our hospital a chance to say thank you, to let the families know their time is valued, and maybe they can use it for babysitting, maybe for gas if they're traveling. It's not a lot, but it just shows their value and how important they are to the hospital. We do have a small budget for our council. There are things that come up, such as we have quarterly meetings where we provide dinner for the families and for the staff that attends. The stipend payments we need to pay out. At the end of the year, we have a celebration, and we need money to fund that dinner and things like that. So we do have a small budget. The reporting structure for our council, it's so important. I think it's simple, but so crucial. Donna, as the Director of Family-Centered Care, reports to our Vice President and our CEO directly, and both our CEO and Vice President attend our quarterly meetings. So they roll up their sleeves and they're right in it with us, both giving transparent reports to the families on progress of the hospital toward the corporate goals, to the organizational goals, as well as just the day-to-day happenings going on at the hospital. And they get family feedback from that dialogue. So that happens at our quarterly meetings as well. But our senior leadership, our CEO and our Vice President, their involvement is so key to our success, just as much as the families and staff involvement. So the way we recruit our families, we advertise through various mechanisms. We have, things, flyers in our lobbies. We have electronic mailings that we send out, invitations for families if they're interested to give us a call and set up interviews. We have monitors in our different lobby areas that'll show that we're looking to recruit for our council. We also will reach out to different managers at the hospital or providers, staff members, if they have a family that they think would be a good candidate. We'll reach out and call and see if there's any interest in being part of our council. So there's various ways that we do that, but we do have interviews. We don't require an application. We're not looking for references and we're not looking for a resume, but we do have an in-person interview that we conduct. And we've been using 9 solid questions over the time, the 11 and a half years that we've been in existence. And they really help us to get to know our families better, their communication style. Can they look beyond their own situation and see a bigger picture for all the families that come to our hospital? Some families can do that and some can't. They're overwhelmed with their own situation. So the questions that we have really bring those things out. It's a large council. We ask them, how do you partner with others? What is your communication style? What if you don't agree with the other 18 or 19 people that are sitting at the table? And it's interesting, and they even give us examples, and it helps us to make sure that we're connecting with the right families to help our council continue to grow and help make improvements for our hospital and all the patients and families who come. And it's worked for us. Donna interviews with another family member, and we have a solemn agreement that if we don't rate all our families 5 on a 1 to 5 scale, then we're not going to offer those families a position. And in the selection process, once we make those determinations, we let everybody know if we were able to offer them a position or if we appreciate their and value their practice of patient and family-centered care, but we're not able to offer them a position at this time.
Please advance.
So this is now we get down to the good stuff after all the structure and all. So I love our council, and I've been a member since late 2006. I actually joined the council, and I think the most amazing thing to me is the partnership and collaboration around goals. The goals are meaningful. It's definitely a doer group. Some councils, like we've had the opportunity to talk to other councils, they may bring in speakers, they may have topics, and that's wonderful. And that can work for some, but I love our council because everything we do is going to have an effect on the patients and families that come and on the staff, and it's going to improve and make it better. We know, because we come for services, we know where there may be gaps. We love our hospital. We're invested. We're all in. But we do know we can always do better, and we're able, from a family perspective, to share where those things might be opportunities where we can make improvements. So I love the work is so meaningful, and over all the years we've been able to accomplish our goals. The way we come up with the goals is we take 2 months out of the year, and at our larger council meeting, and we usually do this in December and January, and Don is just an amazing leader for us. And it's just anybody who has an idea on any area of the hospital services, customer service, any facilities, and how to make it more warm and friendly for families, whatever it may be, they can just throw that idea out. And Donna, says to us, don't think of barriers, don't think of the money involved at this point in time. We're just brainstorming for improvements, and it's wonderful. And then it's really amazing, but there's themes that will arise. It'll be around communication, maybe improvements, or it might be around education. It might be around resources. And Donna kind of categorizes all the different ideas into these columns, and then we prioritize what are 5 or 6 areas that we want to work on throughout the year. And as our council has progressed over the years, we've really gotten good at aligning our goals as families with the goals that the hospital also came up, because our partnerships have gotten stronger and stronger over the years, and we're kind of on the same page and complementing one another with what we would like to see happen. So it's very exciting work.
Please advance.
Do you mind if I stop for just a quick second? We have 2 questions in chat, and they're actually referring to your last slide and kind of about the selection process for your advisors.
Sure.
The first question from Ramona, can you share the 9 questions that you use for the in-person interviews?
I think Dawn is on the same wavelength as all of you, because she actually pulled them out for you.
Wonderful. So that's something, yeah, Donna, if you want to send it to me, we can send it out to everyone who registered.
Yeah, I certainly can. We
Okay.
can share that with you. It's part of our toolkit that we had created, and we're happy to share because we all learn from each other. So
Yes.
definitely I can send that to you, Lindsay.
Definitely. Wonderful. That's perfect. And then we have another question from Emily. She asks, what efforts do you make to ensure that the families are representative of the community that your organization serves?
Yes, so this is also very important to us. Diversity is so important, and you do want to have the voice of all of the families that you serve. So we absolutely do our best to consider that while we're interviewing. One of the things we ask families to share their experience, their background, their culture.
Yeah, take a excuse me. Yeah, when Pat and I are on interviews together, we do that, but we also look at, we have over 13 sites, and we're as far as North Jersey, going down all the way to like the shore area, to our coast area, right? We serve so many different types of families, bilingual families, right? Families from ethnic backgrounds, minority groups. So, we keep that in consideration as we're interviewing. And, it's not only about the different service areas they receive at the hospital. We have to make sure that we have representation on our council and actually on our staff who also can meet the needs of those populations that we serve. It's critical.
Wonderful. Thank you very much.
You're welcome. Good. This is on families and staff working together. Yep.
Okay. Great. So thank you. Those were great questions. Okay, so going back to how our council functions, so we prioritize from that brainstorming list our goals each year, and then we meet one time a month as a larger council, and then we break down once we have those goals, and each work group takes on a goal. And they have another meeting during the month, so they can continue to advance that goal. They bring it back to the larger council meetings the next month as a work group update, get feedback from the larger council, and then again they meet. And so it goes till we actually accomplish our goals. It's real important, for the closeness of our council. We have great relationships together as we work towards our goals. But again, I'm embarrassing Donna, but she's just a phenomenal leader. I think that she's a key to our success. But it's not just the collaboration and partnership, but it's the recognition and the behind the scenes calling families. Are you okay? Is the work group working well for you? Thank you so much for your participation at the meeting list. And making the members of the council individually feel valued and respected, it just helps them to grow in their role. They blossom in it. I think if you just put people together and expect them to come back every month and you don't give them that recognition and that thanks, that you may not make it. People need to feel like they're appreciated and valued. We all do. So I think it's not only the partnership, the collaboration, the consistency. We meet the third Tuesday of every month as a larger council. We always meet. If the weather's bad, we meet by telephone. We have telephone conference lines set up for the families. We meet using video conference equipment. We do everything we can to ensure participation on behalf of our families and staff. And then we don't forget to celebrate. We work hard all year. We've always achieved our goals most of the time at a very aspirational level. And we have a very large celebration at the end of our year. Our CEO is there. The CEO from our larger hospital system attends, and we get to share with one another how we achieved the goal, what we've accomplished, and maybe what our hopes and dreams are for moving forward.
I mean, we're so fortunate. I think like our success over the last at least 8 years, we've achieved like 95% of the goals at the aspirational level. So it's just been a true testament to the types of families that we have on the council and then the staff that volunteer. It's just been amazing work. Next slide, please.
And this is just kind of a graphic that illustrates, what we've already shared with you, but we have our family faculty and family advisory council. Donna oversees and supports all of us so we can do our best, and she reports right up to our vice president, chief cultural officer, and our CEO and president.
Next slide. Thank you.
So now we're going to get into some of the partnerships we've had and what we've been able to do together, families and staff working in partnership. So this is our tablet registration and patient and family portal. And what's amazing about both of these electronic technology that we use, it wasn't developed by a technology group at our hospital or a strategic improvement area alone. It was actually with families sitting side by side with them. So the look of it, the navigation of it, the ease of use, all of those components were collaboration, which kind of ensures that the families in large are going to be able to use it, enjoy it, it's going to meet their needs. So those are two of the technology kinds of things we created in partnership. Next slide. Yeah, the next slide.
Lindsay, can you advance the slide? Thank you.
Here are some more, resources that we created in partnership with various staff. So Donna talked earlier about the Pocket Pal that our finance department worked on with us in collaboration. And it really, it's an interesting story on that operations committee, just one of the committees our families serve on. At one of the meetings, the finance department wanted input from everyone in attendance on how they could better collect the co-payments and the balances from families. They were feeling that they just weren't getting enough revenue, and they were worried, and they came to the meeting. And there were families at that meeting that shared, well, what do you share with the families? Do you just send the bill with no explanation of what the family's responsibility might be, or do you talk about that up front? And at that time, and this is, a few years back, they didn't really tell the families anything about it. They didn't want to upset them. If they couldn't pay when they came for their appointment, they didn't say anything. They treated. And, the families were able to say, if you don't share this with families, what the billing is, what insurance will cover, how they can navigate their insurance, they can't partner with you to pay their bill. So this resource was a guide to that. It was what all the terminology that is involved in insurance plans, and it was kind of empowering families. We want to give you the best services. This is what's involved in terms of the financial aspect of it. Here's resources. If you can't afford to pay, there's resources out there you can investigate. And all of that was in this little book, and it was really helpful. Then as time went by and insurance got a little bit more complicated for our families, we developed, in partnership again, an electronic tool for families. So they can actually go to this on our hospital website, and you can put in your own information and see what plan might work best for you and your family. Is it a high deductible plan? Is it an in-network plan? Those kinds of things. And it just really helps our families so that they can partner and do their best to meet their financial responsibilities as they get services for their child. And then next to that are just tips from families to families in collaboration with staff on how to have successful visits, whether it's medical or therapy visits. And of course, this is all in both English and Spanish for our families on our hospital website and in our lobbies.
Next slide, please.
And the two resources that are on this page, again, in collaboration with staff, we have a family-to-family newsletter. This was a hard copy that we do, but we also post it on our hospital website, and it's written by families to help other families on their journey with their children. The other one is an e-newsletter, so it's kind of an email blast that goes out every month, and it just has some key resources for families for that month that might help them. Some of them are community-based, some of them are agencies or resources in our state that are available, but this has grown. Donna would know.
Yeah, we started with 2,100 families on, and we're up to 24,000 families right now. So this has just been amazing. And I actually have a family who is the one who facilitates this and organizes. It's done at the family level. I think that that's why the connection has been so valuable. Next slide, please.
And then these resources were for our long-term care families, but it's so interesting because this was created, families in partnership with staff, but the family that was instrumental, well, both families, they both had children that lived on our long-term care unit. So they knew what would be important to a family in a brochure, in a guide, and both of them are very successful tools for those families.
Next slide, please.
Okay, this slide is about education and support for our families. So these are both council-based resources. The first one is a flyer. A group of families from the Family Advisory Council. Our kids all have special needs, and so they go to special education in public school. And they provided a in-service for families on, how to navigate special education in our state and how to build those relationships with the school. It was so well attended and so helpful to our families. The other one is an inpatient support group. 2 families that are on our council who are inpatients at our hospital with their children come in each month in partnership with our nursing staff and offer just a support group. They share their story with families, how they were admitted, the circumstances, how they got through the rehab process, and they offer them a message of hope and encouragement that they can do it too. And it's very, very successful. Many families benefit. They attend every month, so it's really good.
Next slide, please.
This slide was an in-service for staff, and it was kind of tied into one of our Press-Ganey questions that we did pretty well on. Press-Ganey has a score of 1 to 5. We got 5s, but maybe more 4s than we would like. So the council worked together with staff to put together a workshop for staff in a multidisciplinary setting, which isn't always the norm. Usually departments meet individually, but this one involved all different areas that are taking care of our families. And we actually had a family from the council who portrayed and role-played what it's like from that first phone call to our hospital through the treatment process, whatever that may be, medical therapy, whatever, through the discharge process. And exaggerated areas where maybe things could have been done better. So a little humor was involved, but it really got the point across, first of all, how one department affects another department, how one department sets the tone for that family. And it meant a lot to our staff. They really appreciated the insight that our in-service served. It was very well received.
Next slide, please.
So, we've talked a lot, and we're hoping, you're going to give us some feedback, some lessons, that we learned along the way, or things I can tell, just from your few questions that you're already thinking about. We talked about the commitment from leadership. We talked about the meaningful work. We talked about recruitment, and you touched on, so many aspects just in your couple questions.
I think I have to go get the Easter candy stuff this weekend.
The diversity that you need to consider, the different cultures, lines, all of those things. And Donna will share the questions we use to help us get to that. The flexibility in our meeting schedule and make it as easy as possible for families to give you their best participation. We use phone lines and video conferencing, but I'm sure there's other technology that's out there that might help your organization. That's just kind of what we do right now. And I can't tell you how important it is to develop and nurture and cultivate those positive relationships with the families and staff on your council to help you become a cohesive unit where you're supporting one another, bringing your diverse ideas and opinion, but working together towards a goal and feeling the success that you can achieve if you work together. This is just...
Next slide, please.
Oh, I'm
Wait
sorry.
1 second. No, you're
Sorry about that. This is a graph of 2017 to show you the positive outcomes are because of the way our culture has grown and is grounded in patient and family-centered care from our Press-Ganey. It's our Net Promoter Score, which is related to that. And if you use Press-Ganey on how likely it is that you would recommend our hospital, to others. And we're really proud to say that we're not where we want to be yet, but as of the fourth quarter of 2017, we're at 79.20%. And our goal this year, our organizational goal is to get that over 80% consistently.
Next slide, please. Before Lindsay starts this video, I just want to share with you, this video was created by Chuck Chenise. He is our Vice President and COO of the hospital. And we just wanted to share for the leaders on the phone that we wanted to have you hear his story of how patients...
What I end up doing, because I get nervous, is at the end of every week, I write down what I haven't gotten.
Sounds like we have some background noise. Cheryl, I think, can you please mute yourself?
I looked at it, and when I really read it, it was really small about it. So that's why.
Or Stephen, can you help me? And thank you. Sorry about that. Go ahead. Donna, are you still there?
Yes, we're here.
Okay, sorry, that interrupted your presentation right there, but please.
Yeah, that's fine. I just was sharing, this is our leader of our hospital. He's our Chief Operating Officer and Vice President, and just wanted you to hear from a leader perspective, his viewpoint on how we do our work with patient and family-centered care.
My name is Charles Janisse. I'm the Vice President and Chief Operating Officer of Children's Specialized Hospital. We at Children's Specialized have long recognized the great value of collaborating with our families and patients. We have great technology, but that's not enough. It's how we use the technology to meet the true needs of our patients and families is what really matters. It's taking great technology and adapting it to the precise needs of our patients and families in creative, straightforward, simplistic ways that emulate the human behavior of how they function, live their lives, and care for their loved ones. That will move the dial. Solutions must be simple, straightforward, and feel natural. That will be transformation in healthcare. That will make the difference. Not taking our technology and having patients and families fit into it because we know best. That's where our partnership with Family Faculty comes in. Donna Provenzano and her incredible team keep us grounded on what really matters to our patients and families and what will truly make a difference in the patient experience, reducing stress for the family, providing a holistic approach to care, providing tools that will really make a difference, and most importantly, achieving better outcomes. They also keep us focused on why we do what we do each and every day. Donna and her team are integrated at every level of Children's Specialized and work closely with full transparency with our senior leadership, clinicians, strategic improvement, and all other teams in helping us understand what really will make a difference in the lives of our patients and families. Their passion and commitment to their purpose is incredible to experience in action and is powerful. We have them at the table at every level of what we do to give us the advantage of understanding exactly how our patients and families see the issue. Understanding a need is not enough. Having a thorough understanding of how to precisely deliver that need is equally important. I'll never forget one of my first experiences at Children's Specialized when the team unveiled our patient portal and tablet-based registration to the Family Advisory Council, and many family members started crying with tears of joy. It was then and there I realized the power of what we were truly achieving through this collaboration and how critically important this is for any healthcare organization to position itself in the marketplace and, more importantly, achieve greater outcomes for our patients and families. As healthcare leaders, we have an obligation to get it right, not get it halfway right, but to get it entirely right, and not get it right as we as healthcare leaders define right. Right as defined by our patients and families. The healthcare landscape is changing as we know it. The change is occurring rapidly and occurring on multiple fronts. Reimbursement methodologies, patient expectations, delivery of care models, and on and on. The one common denominator in all of it is the patient. And in order to thrive and excel, organizations must take command of listening to their patients and families. The only way this happens is to integrate families in ways that will give them influence to shape decisions and drive initiatives to include the patient and family perspective. We have two ears and one mouth for a very good reason. The message of nature here is to do double listening than talking. Truly listening with both ears and then devising solutions around our patients' and families' voice is the key to helping all of our patients reach their full potential. They're counting on us to get this right. Together we can and will make a difference. It's our legacy as healthcare leaders.
Thank you, Lindsay. I just get choked up every time I hear that. I mean, he's an amazing leader and just someone who truly understands the value of partnering with family. And I think when you say, you know, what's the secret to the sauce, you have to have a leadership team that has a commitment to patient and family centered care. And, you know, we're so fortunate here at Children's that we do. And I think that that has been tremendous to the success that we've been able to have. And these are just some of the awards that we've been recognized with for our program and our efforts that we wanted to share. I don't know if you have any other questions now. I mean, we're done with the formal part of the presentation. You know, we hope that you can take, you know, any bits and pieces of what we shared, and, you know, we hope that that will help you on your journey. You know, we're here as a resource, you know, to help anyone or any way that we can. You know, Pat and I are always open to that. So, I mean, thank you very much for having us today.
Thank you, Pat and Donna. This was truly eye-opening, and your organization really can be seen as the gold star for patient and family-centered care. So thank you for sharing all of your success with us. It's had me floored of all of the amazing work that you've done over the last many, many years. I'll start with my question, and then we can open it up to everyone else. But I would like to really hear kind of the one main point that is the biggest attribute. What's the biggest attribute to the success and the sustainment of patient family-centered care at your organization and or the Patient Family Advisory Council?
You want to go? Okay, I wanted to see if Pat wanted to talk first. Probably I think it was the structure of how we went about, I think, organizing the program. I think hiring families, but we didn't just hire one family. You know, we set up our structure was to hire multiple families, and they're at per diem status. You know, because our organization is so spread out across the state, I think hiring families, having them at all of our locations, getting them on all of our committees, like slowly help, like they helped plant the seeds and start to change that culture.
Yeah, I mean, from a family perspective, and, you know, I'm a family faculty, and I was with the original group of families that were hired. It didn't happen overnight. In the beginning, you know, it was just 2 hours that I was here. And it was at the same time that families were hired, there was also a very positive education going on throughout the whole organization on patient and family-centered care, what it meant to partner with families. And it was kind of a gradual but very persistent and growing change to the way, you know, the culture, as you guys call it, you know, the culture at the hospital. That coupled with the support that as families, and we were, you know, on committees and also supporting our families, nothing was scripted to us and nothing was off limits. We weren't just called in when it was thought we would be beneficial. We're part of the day-to-day happenings at the hospital, and we're there to support families and staff daily. So no one tells me what I can say or can't say. I go through a hospital orientation process, but my voice matters to them. I feel valued. So I think that's a key to it too.
And I think on our council, probably the key to our success, you know, in going on 12 years is the meaningful work. Is that, you know, I'm not there. I could very easily go to our council meetings and say, these are the goals that we're going to work on. I don't do that, right? There's a reason why it's a family-driven council. But to collectively work together, even with our senior leaders in developing those goals, it's given them true purpose, and it's work that's aligned now even more so with our organizational goals than it ever was before. The council is supporting those goals. So I look at that because I know some councils struggle. You know, some councils struggle because they'll bring in just volunteers for families, and some councils have come to talk to us. They're struggling because they maybe are not having them work on goals, but maybe just having them there, you know, for staff to come to talk to. Like, so if you ask us, I think both Pat and I would say it's the meaningful work that they do that has sustained them.
That's incredible, and I hear you through and through. The patient family centered care, it's truly integrated at your organization. So congratulations on all of your amazing work. We do have about 4 more minutes if anyone would like to speak up or has any other questions.
Hi, Donna and Pat. Thanks again. This is Libby, and just a great presentation. I was so floored when I saw you guys in New Jersey, and so really wanted to share this amazing work with this community. Can you speak to, so you sort of hit along the lines that it's a journey and it takes some time. Are there any specific strategies you guys used to get leadership on board? I mean, you've got such amazing leaders in Donna and in your COO, but did you nurture that leadership buy-in, or how might some of our colleagues on the phone work to get their leaders to the level that Donna and your COO are at?
Well, I think, we were very fortunate at that time. We had a fairly new president, and she's amazing. She's actually a president of our southern region for our larger health system, Amy Mansue. She gave us her commitment to patient and family centered care. We were all in, right? She said that we were all in. It didn't mean that we weren't going to make mistakes, right? There is no cookbook for how to do this. We have challenges every day. There's not a day that goes by. I learn every day of something we could be doing better, where we're not partnering and we need to partner, or we don't have a family representation. But I could say that once we had that commitment from Amy at the time, she was our president and CEO, her leadership team, and then giving us the blessing. You need to have someone, whoever is going to carry this out kind of grassroots on the ground, they need to be someone that is passionate, is going to be persistent, because I had to do, I was not the director of family center care at that time. I know I had shared that, but as I slowly became the director of family center care, I had to do a lot of behind the scenes work. I had to do a lot of individual meetings with different directors. At the time, I'll give you an example, our director of patient care coordination, she thought, well, gosh, you're bringing families on the unit, they're going to take over what my social workers are doing. No, they're not social work. There was so much behind the scenes education. But I can truly say, when you have an organization that's committed, it got so uncomfortable that some of the people in those management positions who didn't want to believe in our mission, vision, value, culture, patient, family centered care, they're no longer with the organization. I'm just being very honest. This is how it was very clear that we were going to practice this way.
Wow.
And they were some of our, some top leaders and directors positions. I don't know how, Pat, I don't know if you want to share, but that's.
No, I think it's going to, you might want to share, Donna has a great example about our chief medical officer at the time. Initially, he would invite us to meetings, but he didn't really want us to talk or participate. Or he would invite us for a little section of his meeting. We'd have to wait out in the hall till it was our turn to go in. And as time went by and he saw the impact we had on the patients his doctors were caring for, and the support we were giving his physicians, who, sometimes they might get frustrated if a family was, in their face, so to speak. We could support them with that. When he saw what we could bring to the table, it was a whole different thing. He'd invite us for the whole meeting, but it didn't happen overnight. It took time to build those relationships and for us to show our value.
And even, probably if you want to say one of our most, I don't want to say frightening meetings, but that's what comes to mind, was, when we met with all of our physicians, we were going to have a conversation about them. And we love our physicians. They've treated our kids. We know, but we wanted to talk to them about sensitivity and how they share information. And, but it's really having the courage to have those open communications, and just being respectful of each other's role. And we're not saying that we didn't stumble and fall, children's, but I think it's just, even if you do, that you're just going to continue to move forward. You never lose sight that everything you're doing today relates back to the patient and family. So I think that that's what kind of keeps us on our journey.
Definitely. Well, incredible work. And I'm sure it's been really inspiring to see that transformation among the people that you're working with as well. So again, thank you, Pat and Donna. This was really incredible. Very inspiring. You can see the comments in the chat. Excellent information, impressive, fantastic, so great. So I just want to thank both of you again and thank everyone else for joining today's workshop. This has been really incredible and eye-opening, and I think we all really appreciate you, Pat and Donna, for taking the time to talk to us today. So thank you.
Thank you so much, Olivia. It's very, very kind of you. Thank you guys very much. It's been a pleasure.
Thank you so much.
Great. Thank you, everyone, and have an amazing weekend.
Thank you.